techniques that are needed to treat their patients with evidence-based medicine. So evidence-based nutrition. So keeping nutrition in the center of the healthcare system, that is what the mission of PAN India is. So just a brief introduction about Dr. Akil Taher. Bhavani, the slide is not completely seen? So Dr. Taher is a practicing family physician, and he lives in Atlanta now. He's a renowned speaker, an author, and a strong advocate for whole food plant-based lifestyle. And he believes that what we eat is the most important pillar of lifestyle medicine, and a philosophy which leading to a way of life that puts the responsibility of leading a healthy lifestyle into the hands of the patient, so in our own hands. And in his book, Open Heart, where he shares his own story, a transformational journey of a doctor who, after bypass surgery at the age of 61, ran marathons and climbed mountains. It's a really, really inspiring story. A year after his bypass surgery, which was at the age of 61, he undertook a mountaineering trek to Mount Kailash. A year after that, he ran a full marathon in Chicago. And a year after that, he climbed the Mount Kilimanjaro. So that's just amazing. It's a remarkable journey from being a heart patient to climbing the mountains. And he also indulges in a lot of other adventures like skydiving, hang gliding, triathlon, century cycling. I don't even know what that is. And all this is possible because he changed his lifestyle, including making changes to the eating habits, healthy eating habits, regular yoga, meditation, and exercise. And he has educated thousands to understand a way out of pain of chronic illness and disease. And today, Dr. Taher will be talking to us about treating, preventing, and reversing heart disease and other chronic illness, in particular in the South Asian population. So over to you, Dr. Taher.
Thank you, Amrita, for that very kind and a very generous introduction. I would like to tell my colleagues all over that I would like to basically share my insights about preventing, treating, and reversing heart disease and other chronic disease from a healthy lifestyle perspective, which is evidence and science-backed, and also from my personal journey. So with that, let me start my slide presentation, which I would like to go back on to here. And I will, how do I go back on to I'm a co-host, right?
Yes, you were co-host.
All right. All right. Make it over here. Let me get my okay. All with me? Can you see my screen?
Yes, we can.
Okay, excellent, excellent. Let me just get this. So, let me start by saying that heart disease is the leading cause of death in the US, India, and worldwide. It kills more people than all the cancers combined. Even during the height of COVID, in America, it was a #1 killer of heart disease. Now, sad part is that only 50% of men and less than 40% of women are aware of this. That is shocking. And younger people are dying of heart attacks in their 30s, 40s, and 50s. And 50%, as you all know, die with their first heart attack. So going on to now, why is it that we South Asians are the heart disease, we are the epicenter of heart disease? Why? Who are the South Asians? These are people from India, Bangladesh, Nepal, Pakistan, Sri Lanka, and as far away from Bhutan and Maldives. Now, South Asians are approximately 25% of the world population, but account for 60% of heart disease, coronary artery disease being the mainstay. And in the US, South Asians are 4 times more likely to get heart disease than other ethnic groups like Japanese, Chinese, Koreans. And moreover, we develop heart disease at an earlier age. 25% of heart attacks occur before the age of 40, and 50% occur before the age of 55. In India, heart disease doubled from 1990 to 2019, making India one of the heart disease capital of the world. We have roughly 1.45 billion people in India, and 45 million have heart disease. So the American Heart Association said that being of South Asian descent is an independent risk factor from coronary artery disease, apart from others like hypertension, smoking, blood pressure, etc. And we should be worried about this. Why is it that I get calls every week of somebody who's 48 years old having a heart attack? Men, women, because it is equally important in women. Now, when you look at the next, if we treat by lifestyle changes, healthy lifestyle changes, nutrition being the main cornerstone, you're also treating other chronic diseases. And what are these chronic diseases? Heart disease, stroke, chronic lung disease, diabetes, blood pressure, cholesterol, obesity, renal disease, and certain cancers. And what do they have? All these things have certain things in common. Inflammation, number 1. Oxidative processes, number 2. Disturbance of your gut bacteria. I mean, there is so much we can talk about gut bacteria. I have given talks on this. Shortening of our telomeres. What are telomeres? Little caps on our chromosomes which protect our DNA. Overstimulation of the sympathetic nervous system on a chronic basis. That means your cortisol levels go up high, you start eating more, you start getting obesity, you get diabetes, and whatnot. So if you treat one of these diseases by nutrition and the 6 pillars of lifestyle medicine, you are treating all these. So we would go around the heart. See, the people don't understand. A healthy heart is a very resilient organ. Tell this to your patients. It can withstand and recover from physiological stressors, such as physical exertion, mental and emotional stress. What is the size of your heart? It's the size of your fist. Each day, the heart beats 100,000 times a day and pumps 2 gallons of oxygenated blood to every tissue and organ of your body through millions of miles of arteries. So, in a 75-year lifetime of a person, take for me example, I'm 76 years old. My heart has already beaten more than 3 billion times. And what protects his heart? We all know the coronary arteries, if they're healthy. And we also know that the left anterior descending is called what? A widowmaker. Why? Because for the longest period of time when I was a medical student in 1970s, it was, and all my textbooks, and I was taught this, that heart disease is a man's disease, not a women's disease. But now we realize that heart disease claims the lives of both men and women equally. So please remember that now it should not be called LAD, should not be called the widowmaker only, it should be called the widower maker also. And going next is that, so to understand, let's go this fast because most of you may be knowing this. To understand the blockages of the coronary artery, we look at a cross section of the coronary artery. This is your endothelial lining, which produces nitric oxide. And this nitric oxide is a very powerful substance. And this one keeps the coronary artery dilated, blood flowing smoothly in the lumen, and it protects the arterial wall so that it remains supple and elastic and does not get hardened to cause high blood pressure later on. But folks, what happens if you routinely have a rich, unhealthy diet? The standard American diet, so aptly called the SAD diet. It is a Western diet of dairy, eggs, meat, carbonated, sugary drinks. I mean, think about it. French fries, the humble French fries, which does no harm, soaked in oil, donuts and burgers and pastries and cheese. And for that matter, the junk food vegan diet that we have in India too. Dairy, trans fats, saturated fats, oiled, processed foods, the Indian cheese, paneer, salty foods, sugar. And make no mistake, ghee is clarified butter. It increases oxidized cholesterol 10 times more than regular oil. So what happens when you have a diet like this? You damage your endothelium and your arterial wall. So once it damages, nitric oxide is not produced as much, and you start getting this gooey stuff, the plaque formation, which narrows the lumen and reduces the blood flow, and eventually starts causing chest pain on exertion. But remember, it takes decades to form this, in what we call, as doctors call, angina. Now think about it. It takes decades of plaque formation. So new blood vessels, the collaterals, also start forming around the heart. And these collaterals keep the blood flowing to the heart distally to the blockage. So your heart is never devoid of blood flow. There is a chance, but a very little chance of getting a heart attack. Heart attack. Now, on the contrary, what is a heart attack? These are younger, friable, soft clots which rupture suddenly, forming emboli. They cause a blockage to a certain part of the heart. This is a heart attack when 50% of the people die with their first heart attack. And you should always tell your patients that if you have this kind of a situation whereby you have this Hollywood or the Bollywood type of a heart attack where you clutch your chest and you're falling on the ground and you're dizzy, then obviously you should go to the emergency room where they'll do your EKGs, they'll do your blood work, your troponin levels, and then they find out you're having a heart attack. You're given blood thinners, you're taken to the cath lab, your clots are removed, boom, 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 and stents are put in. And if your stents fail, you get open heart bypass surgery. Why do I say this? Why did I tell you about the angina and the heart attack? Because, folks, I had angina. I'm a heart disease survivor. My plaques were large, thick, containing calcium, scar tissue, and sturdier. Unlikely to break, unlikely to cause a heart attack. Two of my arteries were 98 to 99% blocked, but I did not get a heart attack. So, the large international study from New York University and Stanford that invasive procedures are no better than diet, medication, and lifestyle changes, even in severe but a stable heart disease. And Dr. John Cook of Stanford has gone a step further that 50% of stents, angioplasties, and bypass surgeries done in the USA, and probably in India too, are unnecessary and should be only done in emergencies like a heart attack or when medication, lifestyle changes, and diet fail. They do not cause your longevity. It has got nothing to do with that. So the whole idea is that I am going to make you a bold statement. Had I known then what I know today and understand today, I would have looked for other options besides stents and open heart surgery. And so let's talk about these options. What are these options? It's a whole food, plant-based diet. So what we talk about is that this is, you must have all heard of Dr. Esselstyn. In fact, I'm meeting his son for a talk, but Dr. Esselstyn's patient, he was a colleague of his, surgeon, who had multiple vessel disease, and he had so many other problems that he was not a candidate for surgery. So he was put on a whole food, plant-based SOS diet, no salt, oil, or sugar. This was the state of his artery, coronary artery, moth-eaten, red tail appearance kind of blockages around here. And in 3 years, his coronary arteries dilated. Without stents or surgery, only on a whole food, plant-based SOS diet. Now, there's a recent study done by Dr. Dean Ornish, which you must have also heard about. I met him personally and talked about several things. Now, Dean Ornish says his study was 35 patients with severe heart failure, less than 30% of your ejection fraction. And they were all waiting for heart transplants. They were all put on whole food, plant-based SOS diet. All of them improved the quality of life, and 5 did not need transplants. Just by this. So we go on to my story. Well, my story is that till the age of 61, I was a creator of my own unhealthy lifestyle. I spent most of my adult life eating all the junk food, whatever is in front of me, unhealthy diet, drinks, and without worrying about what effect it would have on my body. At that time, I was also working very hard, long hours, without paying attention to my health, and I slept not more than 4 to 5 hours in the night. I say this because when you talk about the 6 pillars, this is going to be important. And when I was not working hard or eating what was in front of me, in fact, I was called a seafood eater, SEE. I ate everything at sight. And then if I was not eating or working hard, I was a complete couch potato. I would be lying on the couch without knowing the meaning of exercise. I did exercise though, I correct myself, for my hand muscles. I took the remote to change the TV channels. That's all I did. Now, my family history is challenging. My brother died tragically at the age of 52 of a stroke. My sister and my mother both succumbed to heart disease at the age of 69. And then on top of this, I have a WPW syndrome, Wolff-Parkinson-White syndrome, that extra electrical pathway that can lead to rapid heartbeat. And lately, I had to tell my cardiologist that my cholesterol is not coming down. Why are we not doing LP little a, the lipoprotein in the blood? And guess what? My lipoprotein LPA is normally supposed to be 30, mine was 361. It is genetics. It is passed through my parents, and there is no treatment right now. They're doing a lot of research on this. So all this led to a kind of a stress, chronic stress, which I could not handle. So I was not surprised when heart disease came knocking at the age of 56, and I had to have stents. My plaques were so thick that they had to use a diamond tip drill to shave off the plaques. And in the process, I got a cardiac arrest. My heart stopped. That too shocked me to get my heart beating again. This is not shocking. What is more shocking than this is that brilliant cardiologist who saved my life that day, 2 years after that, he died of a massive heart attack on his treadmill. And what? Guess what? He was a South Asian. And how old? 48 years old. So now, all you doctors, my colleagues who's be thinking, now this old man, Dr. Taher, must have changed his lifestyle after the stents. Nope, I did not. I thought medical science is going to get me out of this. I was under denial. I said, let me face it. So I got into a kind of a depression. 5 years were horrendous. And then my stents obviously failed. I had to have open heart surgery. Now, mark my words, I'm going to do a half marathon in a year's time if all goes well. This is what I told the ICU nurses. Some of them joked, some of them laughed, humored me. And I don't know why I said that at that time. But now, retrospect, I'm thinking that maybe I had only two choices left. Either to continue this horrific end of lifestyle that I was leading, or to make a conscious decision to start leading my life with purpose and passion. I chose the latter. So my recovery was remarkable. I was on the treadmill on the very third day. I did not take a single pain medication, even though with the horrendous heart surgery when they open your chest. And so I started changing my lifestyle. I started eating better, not plant-based or vegan yet. Eating better, exercising, meditation, yoga, spirituality. And I found that I was getting better. So to keep the promise to the nurses, in 7 months' time, I did my first half marathon in 4 grueling hours. But my bruised heart did not fail me. It carried me over to the finish line. From then on, like Amrita has already said, I went a year after to Mount Kailash on foot. There were 30 of us. 4 of us did it on foot without oxygen or sitting on a donkey. And there's a story about it. They wouldn't let me do it. They said, you're a heart patient. But surprisingly, I was carrying Dr. B.J. Patel, who was my cardiologist. I said, I have a cardiologist with me. Why would you stop me? And so they let me do it. And I am very happy. I got certain kind of peace at that level in Mount Kailash, which I did not understand much. But my wife noticed the difference in me when I came down. Anyway, after that, there was no stopping. Did Mount Kailash, Mount Kilimanjaro, triathlons, and all that. But I was thinking about, uh, you know, I even though I was better, I would still get my diverticulitis. And this diverticulitis had perforated twice. And the second time they were going to ask me for surgery. And I would still get my attacks, like the surgeon, my friend, was standing over me. The second time it got perforated, I was 15, 20 days in the hospital. And he says, look, Akil, if I don't do surgery on you now, you may not survive. So I would still get my diverticulitis attacks. And I was wondering why. So I started researching. And when I went deep into research, I started researching on ways of how to heal the body without solely relying on medication and invasive surgery. That is when I came across the 6 pillars of lifestyle medicine. And this, folks, is your nutrition, the cornerstone, complemented by your exercise, improving your sleep, you're managing your stress, avoiding risky substances, and forming and maintaining social relationships. Now, remember this. These 6 pillars are interconnected. They help each other to work in harmony to produce the best health outcome. A lot of my patients will come and say, but I eat right, doc, and I exercise, so what? But to get the maximum benefit, try to follow all these 6 pillars. And so, the first one, the most important, the maestro of a band or a symphony orchestra is your diet. And everybody knows this. Your fruits and vegetables should be half your plate, your grains, your barley, your brown, be 1/4, your beans and lentil, the other quarter, and then snack on nuts and seeds. What should you do? You buy food from grocery stores, look at labels. Look at saturated fats. Look at those things that you cannot pronounce. If you cannot pronounce something, don't buy it. Avoid processed foods, sugar, cut back on salt. I don't know in India, but an average American has 16 teaspoonful of sugar, processed sugar a day. The American Heart Association says that you're supposed to have 2.5 grams of salt. An average American has 3.5 grams. I say have 1 to 1.5 grams. Avoid meats, saturated fats. Reduce your bad cholesterol. Avoid trans fats like your coconut oil, these are chemically altered to keep them at solid at room temperature. Your palm oil, your ghee. So if you do this, then we come across to the new key nutritional consideration in older people. This is what my patients and my friend and family always ask me. First of all, as you're growing older, your hydration is very important because your thirst centers don't work that very well in the brain. So apart from you hydrating with water, you should hydrate with fruits and veggies, which are a lot of water, like cucumbers or celery or orange or watermelon. So hydrate. Number 2, calcium. Overrated. I mean, the dairy industry is telling you have 1.5 grams of calcium. No, 700 milligrams is enough. And you can get it from your green leafy vegetables like your collard greens or your bok choy or your nuts like your almonds or seeds like your pumpkin seeds, sunflower seeds. Now, the biggie, the important is vitamin D. This production declines with advancing age. 60% of my nursing home patients before COVID, vitamin D deficient. Now, sensible sun exposure from 10 to 3 p.m. is sufficient, and it remains in the body longer, the D3. Now, what does vitamin D do? It helps in skeletal health, absorption of calcium, and prevents you from getting severe COVID. There was a small study done in those days when the patients were put on ventilators. 50 patients were there. All 50 were severe enough to be hospitalized. 25 of them were put on very high doses, 50,000 of vitamin D a day, and 25 were not put on any. Ones that were put on vitamin D, you had only one person ending up on a ventilator, while the other group had 7 people ending up on a ventilator. A small study, but a double-blinded study. Now, so vitamin D, important. Now, some of my patients say, oh, we sit by the window pane and we get the sunshine coming in. No, no. You cannot get your ultraviolet rays from the window pane. You have to be out in the sun. If you cannot, take a supplement. Protein. We all know the bad effects of protein. I mean, on very high temperatures, your meats that you do, heterogenic amines, or your TMA, TMAO, which you must have heard of. But protein muscle mass as you get older decreases, not because of lack of protein, because of hormones inactivity. So all you have to do muscle strengthening exercises, wall push-ups or things like this, carrying bags, because don't run out and start getting protein powders, please. Fiber. Oh boy, fiber is, where did I go now? Fiber is undigestible foods. Your prebiotics. An average person should have 38 to 40 to 45 grams of fiber. An average American, I don't know in India, I think India's diet is pretty good in fiber, but an average American has only 15 grams of fiber. Think that your gut bacteria love this fiber. And it lowers your cholesterol. It prevents you from constipation and complications of constipation like your diverticulitis, which I suffer from. And finally, vitamin B12, that is important too. I believe that people, older people especially, they take all these antacids and so many polypharmacy, they need vitamin B12. And finally, we have I think for fats, we can look at your chia seeds and for omega-3. You can use your chia seeds or your flax seeds or your walnuts or your hemp seeds to get that. So we go next to a very important thing, physical activity. Although any amount of physical activity is better than none, it is important for adults. Tell your patients, please, to engage in both your general physical activity and your purposeful exercise. General physical activity, okay, you do gardening or you walk in the park or you play some game, but what does it do? It burns calories, sure. It increases your endorphins, great. It makes you feel happy. It prevents you from getting stiff and rigid. But you need purposeful exercises. Why? Because purposeful exercises is for targeted health outcomes as part of the weekly physical activity, 30 minutes of moderate intensity exercise 5 times a week. And your heart rate should go to 70% of your maximum heart rate. How do you calculate that? Okay, take from me, for example, I'm 76 years old. My maximum heart rate would be 220 minus my age. It's about 140, 145. 70% of that will be how much? 104, 105. If I do not reach this, at least 15 minutes in my 30 minutes exercise, it is not a purposeful exercise. This is important. And what does a purposeful exercise do? It reduces your blood pressure, your weight, improves your endothelial function that I talked about. Nitric oxide levels increase. It increases your good cholesterol. You don't have to have wine for that. It does nothing anyway. It decreases your resting heart rate in the long run. See, athletes have 63, 64 pulse rate because they're exercising. And the most important thing is it reduces the time for your resting heart to normal after moderate intensity exercise. Meaning what? That if you're doing some intensity exercises, you reach 70%, now you've stopped exercising, how soon can your heart rate come back to normal? If you're taking a long time, that means you're not healthy. It shortens the period when you become more healthy, improves insulin action, and reduces your risk of cardiovascular disease. Now, this is about exercise. What about sleep? I've given talks on this, whole talks on sleep. Sleep, what do you think? Most people, when I talk to them, I say, oh, doc, is when I'm not awake, I'm asleep. No, sleep is an active state of rest. The brain is very active and has an impact on your learning, memory, and immune system. And if you ever get a chance, read the book, Why We Sleep. Fascinating. Most adults require 7 to 9 hours of nightly sleep. Why did I say that the first time? My diet was terrible. I was only sleeping 4 hours a night. If you sleep routinely less than 6 hours a night, there's a Japanese study for 14 years that has been done, which shows that if you routinely sleep less than 6 hours, your chances are 4 times more of getting a sudden cardiac arrest or high blood pressure and heart disease. And this is my favorite, the global experiment on lack of sleep. This, folks, is incredible. You see, there is an experiment done every year on about 1.5 billion people in 70 countries. It's called daylight saving times, which we get in America. What they found was that during the spring, your daylights, you start losing an hour. And the moment you lose an hour, the next day, they found 24% increase in heart attacks. And in autumn, when you save an hour, they found 21% less heart attacks. And that goes the same for car accidents and suicides. It's amazing, isn't it? Sleep is something fascinating. And I cannot say much about sleep. But anyway, what are your suggestions to help you sleep better? Go to bed only when you're sleepy. Why? When you go to eat your food on a dining table, do you sit over there waiting to get hungry? No. Why should you wait to get sleepy? Go to bed when you are sleepy. Only use the bed for sleep and sex. No distractions, no computers, no phones, no TVs. And if you can't sleep, fall asleep within 15 to 20 minutes, get up, leave the room. Go away, start doing certain things like having a massage or reading a book or listening to music. Get back when you are asleep, feel sleepy. Sleep and get up at the same time. Your weekend sleeping for up to 1 o'clock or 12 o'clock or 11 o'clock is not going to help your loss of time sleep in the weekdays. And keep the room cool, 65 degrees, of course, that is a given, but these are important things for sleep. And another thing, keep an alarm clock not to get up, to put a time when you have to go to sleep. Okay, next is your stress management. What is, we're not talking about acute stress when somebody's trying to snatch your purse and your heart rate goes up and your respiratory rate goes up. This is acute stress. But I'm talking about chronic stress when the parasympathetic nervous system goes into an overdrive every single day, or not every single day, but every few days. And then you get into the chronicity of your cortisol levels. So chronic stress is defined as a state of worry or mental tension caused by a difficult situation. Most of the times, these are the 4 Ds. Either you're heavily in debt, divorce, disease, and death. Now, this is where our Eastern science comes into play. This is where your meditation, your yoga, your breathing exercises, your pranayama, all this helps before you embark on medications. And I'm not saying you don't need it, but try these things out first. It has helped a lot of people. Then you go for psychotherapy and medication, but try to do these things. We started it in India. There are more Americans doing it than Indians. So then you come across avoiding substance. Everybody knows smoking. Alcohol, I get a lot of questions about this. If you're not drinking, don't drink. Alcohol does nothing for your physical health, period. Period. It does not increase your HDL, your resveratrol, and all that is all nonsense. You can get it in your grapes. Alcohol does nothing. Now, if somebody says I'm responsibly drinking a glass of wine now and then, I am not being judgmental to tell that person to stop. Period. Street and prescription drugs. This is a havoc in this country. Can you think about the fentanyl and the cocaine and the amphetamines and the oxycodone? Oh boy, this is ruining this country. And think about it, non-prescription over-the-counter medications like your ibuprofen, your Motrin, anti-inflammatory. Just the other day, a patient comes to me. For the last 30 years, he's been taking 600 milligrams of ibuprofen 3 times a day for arthritis. He came to me with what? Heart problems, kidney failing, ulcers. Be careful. Tell your patients. Over-the-counter medication does not mean you just go. And I'm shocked that in India, and believe me, I know this for a fact because I have a lot of my colleagues there. Anybody can get a prescription drug if they know the pharmacy without a doctor's prescription. At least I know that in Mumbai it is a fact. Okay, so next is social support. How many people know about the blue zones? These are places in the world with the healthiest, longest living population. They're in Okinawa, Japan, and one is in Italy, one is in Costa Rica, one is in California, Loma Linda. These people eat a plant-based diet most of the time. They eat only when they're 80% full. But they have social bonds. They share their activity. They laugh and cry together. They share their shared experiences, which lowers the stress and anxiety, which lowers blood pressure and improves heart health. This is where we Indians in India have beaten the Americans, definitely, because you have a social system that allows this. Here, if you go, it's a lonely thing. At times, I've seen my patients who have their pets in the room because there's nobody to see them. So having said that, let's embark on the new breakthroughs in the war on heart. You have the intravascular lithotripsy, but I do not recommend it. It's like have your lithotripsy for the kidney stones, because I've told you, if you have heart plaques, they're unlikely to break, go to a whole food plant-based doctor. Not you, but tell your patients. Cholesterol smashing drugs. This is a great thing because it brings down your cholesterol. If you've got familial hypercholesterolemia and all that, it can help you. Biodegradable stents. Now, this is a must because It remains in your body till medications and lifestyle changes take place, and then it dissolves. And finally, you have the coronary computed tomography and angiography that clearly test CLEE. This is AI, artificial intelligence. This clearly test can figure out a way of whether how much of plaque you have in your coronaries and whether it is soft or hard plaque. One of my patients recently got this done, and she was shocked that, oh boy, she had so much of plaque. And anyway, so this is a test which you can do. These are the breakthroughs right now. We go now to South Asians and heart disease. Just a fair 1 or 2, 3 slides on this. Okay. Now, general risk factors are for everybody. High cholesterol, smoking, diabetes, obesity. The Inter-Heart study has said this. But we have in America a masala study. Masala study is the mediators of atherosclerosis in South Asians living in America. What it did was it took 1,100, I don't know why 1,100, South Asians, men and women, ages 40 to 84 years. And what they found is that we are not normally associated with overweight. If you go to India, you don't see people overweight in the Western terms of obesity with the BMI, where you say below 26 is normal, 26 to 30 is overweight, over 30 is obesity. If that was the case, my BMI was 22 when I got my heart disease. So I fell through the cracks. The healthy distribution of fat is under the skin. So we may look normal, but our things should be lower, our BMIs. And we should do waist circumference rather than the other. We should do waist circumference, which should be less than 35 in men and less than 30 inches in women. And then we go on to South Asian insulin resistance. We talk about diabetes. My God, it is 100 million people are right now from 2022. We have got diabetes type 2. And that is an underestimate because so many of them are walking with blood sugar and they don't know about it. And by 2030, you're going to have 135 million. What is insulin resistance? It is just nothing. It's your insulin which takes the blood sugar to the cells to be used as energy, but cannot because it is stopped by those muscle cells which are blocked by fats. So it comes back into the blood. I found in South Asians very small luminal diameter of the coronaries, smaller coronaries, multiple vessel disease, and longer lesions. A combination of high triglyceride and very low good cholesterol is I've found in so many South Asians, so many South Asians. And triglyceride, this is one of my patients was in Dubai with 10,000 triglycerides. His numbers are 10,000. So, and then high coronary calcium content we have because heart attacks and strokes, these are harbingers. And then you get your higher metabolic syndrome. Everybody knows it. Vascular inflammation, we talked about that. Gestational diabetes. Our women get more high blood pressure, diabetes, high sugar, then preeclampsia, than other women. What happens? This all disappears in 2 or 3 or 4 months. And they're lost. These are the people who get heart disease later on. So our women should be protected, especially when they have preeclampsia or high blood pressure or sugar. Gestational diabetes, we talked about that. Sedentary lifestyle, oh boy, we should all start moving. Dietary habits, we already talked about that too. So we go on, and I would like to here are some things we can do as doctors. Okay, we all can do this. Let's join hands on this. Take a proper family history and ask your patients to discuss it with their relatives and their loved ones. You know, we love to brag about how our children our CEOs and tycoons and doctors and engineers. We never talk about illnesses, chronic diseases. Talk about it. You may save lives in your family and your friends. Explain in detail what a whole food plant-based diet is. People don't understand this. Spend a little more time. Introduce nutrition in medical schools. I had zero nutrition. My son, who is a doctor in the US, had 25 hours only in his 4 years. Educate younger patients on nutrition as atherosclerosis starts at my grandson's age, 8 to 10. As doctors, we should know the risk factors for chronic diseases in South Asians. We should. And then get a coronary calcium scan for all adults who have a very strong family history, even though they do not have any high cholesterol or high blood pressure. Get a calcium scan done. Ask your patients to use less oil. Why? We have a cultural connection with oil with South Asians. If you see a pot of curry on the table, the upper layer is full of oil like a Valdez slick. And the trouble is that we feel we are being generous when we do this. And because of our South Asian culture, we cannot say no. And so we eat it. But it's high time. And in a nice way, you can put your foot down. It's after all your health. And start using less oil. We not only use more oil, we use the same oil again and again. It has happened in my family. Get tested for LP(a). Indians have a high chance of getting your LP(a) high. Ask your doctors, ask your cardiologists, ask your patients to ask the cardiologists. Abstain from dairy and ghee in any form. Exercise and sleep. It should be written on a prescription pad, no matter what situation of health you are in. Follow young women, I've told you, of gestational diabetes, hypertension, and preeclampsia. And avoid alcohol and smoking. And finally, oh yeah, we have done. So thank you very much. This is my website, my Facebook, my Instagram, YouTube. My monthly talk registration is over here, where I've done a lot of talks and I continue doing it. The next one I think is reflux acidity, which I'll be doing on the 20th or 20th, I'm not sure. But if you go and register on this, you will get your emails to ask your patients to register you, even if you all don't want to. But thank you so much for listening. Let's work on this together. And thanks.
Thank you very much, Dr. Taher.
Let me stop sharing. Okay, I got it now.
Thank you. Thank you very much, Dr. Taher, for your time, sharing your incredible journey. It's very inspiring. And thank you for giving us the insights into nutrition and all the other pillars of lifestyle medicine, which are equally important. And we have a few questions from the audience. So
I would love to. I will stay as long as you want for answering the questions. If I cannot answer, we'll both look up and find out. Okay?
It's very kind of you. So we have one question from Antariksha, and she says, how do you overcome mouth ulcers and other health concerns after following a vegan lifestyle? And she also wants to know that despite being vegan, she gets anxiety and anger, and how do you overcome it?
Okay. The first thing is the aphthous ulcers that she's talking about. Obviously, when you go onto a plant-based diet, a whole food plant-based diet, in my own case, I used to get a lot of mouth ulcers, especially after my diverticulitis. I had all these antibiotics, which mouth ulcers were there for months. The moment I changed my diet, I have no mouth ulcers now. So I think that is number one. Number two is anxiety and
And
after becoming a vegan, right, or a plant-based diet. Here, I would like to tell you, my dear, that what did I say? Follow the 6 pillars of lifestyle medicine. So you are following the vegan lifestyle, which is fantastic. But if you follow of how to handle your stress, which you talked about, meditation, yoga, spirituality, exercise. There are now newer studies that have come out, exercise, which are there, which builds up your immunity, which helps you overcome high blood pressure, diabetes, exercise. So I think that if you follow the 6 pillars, and all of you may not be good at all the pillars. For example, myself, I'm still combating sleep. I've got better. I'm now doing 6 hours, but still not enough. So work on those pillars the way what is good for you and what is not good for you. But in the questioner's thing was that try and follow all the principles and you will find all the pillars and you will be okay.
thank you for that. Dharni wants to know, can you please throw some light on MCT oil hype?
What oil?
On the medium chain triglyceride oil hype?
I am not aware of this the oil hype. You can elaborate it and
So the MCT oil is generally the ones sort of derived from coconut oil or the palm kernel oils. That sort of seems to be a little bit better than the long chain triglycerides. Is the hype kind of?
my point is this: that the last talk I gave in London, and there was a lady who stood up and said that okay, the tins which contain ghee, and ghee, if it comes in a natural form, it is good and all that. My point is this: if you are following a whole food plant-based diet and you are trying to uh, do it for your heart disease or your blood pressure or diabetes, then saturated fat is a total no-no, whether it is middle chain or triglycerides, which are obviously coming as energy. And one thing that I must let people know, and a lot of my patients still think to this day that sugar causes diabetes. Sugar does not cause diabetes. Your pancreas are working very well in the beginning. All that your pancreas are doing is secreting the insulin, but the insulin cannot get in. It's your gummed up cell with the fat, which does not allow the insulin to use the sugar as energy, and so you are getting it back out into your into the blood. The Japanese till the 1970s, what was the main diet? The main diet was carbohydrate, rice, with a little vegetable on top, or sometimes a little fish as a garnishing. And there was 1 to 2% diabetes. The moment Americans came over with the McDonald's and Burger Kings and all that, it raised up to 12 to 15%. So I believe that short chain fatty acids or long chain, if you are saturated fats, are no-no. Monounsaturated and polyunsaturated, if you do not have a heart disease and you're using it sparingly, I have no problems.
Does that answer your question, Dharni? Is that what you wanted to know? Okay. We have another question. How do we get vitamin B12 in vegan when you're following a vegan diet?
See, vitamin B12 was basically very rich in the soils where the vegetables grew. But using pesticides and insecticides have killed the vitamin B12. So you can't get, but if you are a vegan or a plant-based diet, you have to take supplements of vitamin B12 in today's day and age. And you can take a small amount, but it needs, because it is for your brain, it is for your nerves, it is there, subacute combined degeneration of the cord because of vitamin B12 deficiency. So it is a must. Supplements should be taken. 2.5 micrograms, or it can go higher up if you feel that your vitamin B12 is less. Now, having said that, if you've got pernicious anemia, whereby your vitamin B12 is not being absorbed from the lining, then you've got to take shots.
There's one more question. Can ejection fraction of 30% be improved? If yes, how?
Whole food plant-based diet. I told you about this Dr. Dean Ornish's thing. 5 of them did not even need surgery. That means the ejection fractions were improving. See, cardiomyopathy, whether it is dilated or hypertrophic cardiomyopathy, which leads to ejection fraction going down. So ejection fraction can be improved. Yes, I have a whole, I think in one of my talks I've talked about it, of how your ejection fraction has, of people who had 35 and 40 has gone up to 50 and 55. Whole food plant-based diet, keep up to minimal oil if you can do without oil, fantastic. And also remember to use slow glycemic foods. Carbohydrate is not bad, but if you are having a slow glycemic foods, which increases your sugar gradually, these are your millets and your brown rice and your quinoa and all these that increase the blood sugar at a slower level.
Gautam Dandekar wants to know what is the problem with desi ghee?
It's saturated fat, my dear. See, ghee is clarified butter. So if you're going to have that, then you have to understand that saturated fat itself can cause high cholesterol. It is a proven thing. So you are going to get high cholesterol. That is why vegans, junk food vegans, have also high cholesterol, not because of only the dairy part of it, but the ghee part of it. And ghee has got oxidized cholesterol. So it increases, sorry, ghee increases your oxidized cholesterol, which is a direct effect on the atherogenesis of your coronary artery, atherosclerosis of your coronary arteries.
Also, he wants
If
to
some,
know, yeah,
go ahead.
do you take natural probiotics like fermented beetroot, cabbage, sauerkraut, or anything else?
Oh boy, yes. Love it. Probiotics. But remember, I don't know in India, but you have probiotic pills and tablets over here. Do you have it in India?
I think we have curcumin as well now and probiotic tablets as well. We get everything.
No.
Tablet form.
Probiotics in a tablet form, we use it for everybody. We use it for dogs' food and children's food and everywhere. It is pills. Okay, this was a study done in Israel, where they found that they did a study, a control study of giving these pills, the probiotic pills, a prebiotic. And these pills just went in and went out from the rectum. So the whole idea is it is a $50 billion industry. So all you are getting is a $50 billion poop. if you take pills. But natural prebiotics, sauerkraut, oh boy, your yogurt, non-dairy yogurts, a kombucha, all these are excellent. Sometimes when my wife gets mad at me and does not cook, then I take some food and some beans and put sauerkraut on it and eat it. Fantastic. I've had no diverticulitis since I've been on plant-based attacks. So the answer is yes. The gut bacteria loves your prebiotics and your probiotics.
So the other question is, does vitamin K2 supplements help in controlling plaque formation?
You don't need vitamin K. You don't need vitamin K. In fact, once you are on a whole plant food-based diet, you do not need anything to control your blood not becoming blockages or atherosclerotic. In my opinion, K has no value. Absolutely.
Yeah,
Why never take anything that you can do without?
true. The less processed food, the less supplements, or the less processed
The
food.
only two supplements that I tell you is B12, especially in older people, and otherwise, if you're a vegan and plant-based, and D.
Another question by Lee is, can heart failure be reversed?
Heart failure cannot, it can get better. Your symptoms and your signs and symptoms can get better. And it cannot be totally reversed, but your ejection fraction can get better. And with your medications and your oxygen and with your uh, diet, your exercise, yes, you can lead a long, long life.
Uh, there's another question. How to increase LDL cholesterol? I think that you meant HDL cholesterol, Lee.
HDL cholesterol is the only thing that I found was exercise. I challenge you, all the people listening today, if you do performance exercises and you are young enough to do it, not old, I'm also 76, I'm doing it. If you are healthy and you're doing it, I challenge you that your LDL, your HDL levels will increase. My HDL was 29 when I was a couch potato. My HDL is now 59. Exercise. Wine, you should say, wine industry, the red wine industry in America made a lot of money because at one stage everybody ran for red wine. Not necessary.
We have a few more questions. Are you okay to take a few more questions, Dr. Taher?
I'm told you, I'll be here.
There's one question, how COVID vaccines affects the heart? I
Well,
think it's a hot topic now.
it's off topic, but COVID does have a lot of these things in terms of coagulation problems, your heart wall muscle problems. And it is such a, the topic of COVID is so bizarre and it is so confusing that even the experts have not come to terms of exactly what is happening. But you have the long COVID where people get short of breath, where people get tired, fatigued. But I'm not an expert, but I do believe that it can cause problems with the heart.
And does long-term use of beta blockers cause bradycardia and calcium deficiencies?
Yes. And long-term beta blockers should be only used in people who got an heart attack, which if your doctor says to slow, what are you using beta blockers for? To reduce your heart rate, to do less function of your heart, correct? So that it helps. Younger people, when they use beta blockers for blood pressure, they start getting pain in the legs and all that because there's not enough blood supply going there. So I believe that beta blockers uh, should not be used unless necessary. In fact, you can get the same kind of if you do your exercise because your heart rate will come back. As I said, your heart rate will reduce and your heart will have to do less work for the same. Your muscles will pull in more oxygen with your heart doing less work.
And are cold press oils better than the other
Which
oils?
oil?
The cold pressed oils. Cold
Uh,
press.
this oil issue comes around in every talk. Any cold pressed or otherwise is a no-no. Oil is a no-no. But if somebody is using it very sparingly, see, oil does no good for anything except for the taste buds. It has got nothing. It has got no nutrients, macro, micro, or vitamins or anything. It's got nothing. So you're using it for cold pressed. It's like your cold pressed coconut water or this. It may be better than using the regular one, but try to avoid it.
There are two questions on fasting. Is fasting good for health, and can diabetic patients do intermittent fasting?
Well, first of all, let me tell you, fasting done rightly is very good. But fasting done, remember, I spent 10 years, 11 years in the Middle East, in Bahrain. And what I found was that during the month of Ramadan, when people fasted, most of them were healthy and reduced their weight. But there was 20% or 25% who increased their weight. Because what they did was, when the fasting was over, they binge eating. So it is from sunrise to sunset. So fasting done properly is great. Now, having said that, generally speaking, it is said that if you eat at sunrise and don't eat after sunset. So if your sunset over here, for example, today my sunrise is at about 7:30, and my sunset is going to be about 5:30, 6 o'clock. If I stop eating at 6 o'clock and eat my next meal at 8:39, I am doing intermittent fasting. So you don't have to go and do intermittent fasting, but you can actually do intermittent fasting if you're eating sunset and give up eating sunrise and give up eating at sunset. Intermittent fasting does help 100%, because this is the time when your cells start regenerating, your muscle cells, your blood pressure goes down, your gut bacteria get rest. They need rest too. So fasting itself is great. Intermittent fasting is also a part of it, but timed fasting is also another aspect of it, that you don't want to eat for a certain period of time. It's fine. But always remember, when you fast and when you break that fast, do not overeat. Then you're jumping from the frying pan into the fire.
Thank you. Thank you very much, Dr. Taher, for your time and for patiently answering all our questions. And it was a very inspiring story. Your story is really, really inspiring. At your age, after a bypass surgery, having done all that, and you continue to do all sorts of adventure sports, it's very inspiring for all of us. So thank you once again, and we look forward to having many more interactions with you in the future. And hopefully someday we will meet in Mumbai.
Sure, sure. And by the way, if anybody, if you all have in your this thing, of course, I'm booked for this next 3-4 months. But in case of like sleep and all that, we can really talk about it, then it narrows down. Gut bacteria, it narrows down. But in the future. But thank you so much, Amrita, and thank you all for being here. I love you all. Take care, and thank you so much.
Thank you very much.
Appreciate it.
You have a nice day. Bye-bye.
Bye-bye.